Thank you to Rare Cancers Australia for inviting me to speak today. I feel very honoured. Today I'll be sharing my story, but my story is not unique. It represents so many rare cancer patients around the country who are living with and enduring similar challenges to me. Over the past few weeks, I've been chatting to my husband Tom and George and my son George about what I'm going to say today. George is a 15-year-old. He's in year 10 and full of energy and optimism. When I asked him about what I was going to be talking about, he said, the value of a life, that's a bit heavy. And he's right. It isn't necessarily a comfortable conversation, but it is certainly an important conversation to have here today. When I think of my value as a person with a rare disease, I think of my value as a mum, a wife, member of the community, as a primary school teacher, a daughter, as a family member and friend. I certainly don't claim to have any more value than anyone else, but I know that I don't have less value either. I know I have value to my family, to Tom and George. We are a tight family unit. George is a miracle boy. I was diagnosed with gastrointestinal stromal tumours in 1996, a few months after my 18th birthday. I'm now 44 and I've been living with GIST for 26 years. I've had some good years and some really tough years, but I've had cancer the entire time. 2003 was a great year. Tom and I got married, and then in 2006, our son George was born. I feel very fortunate to be alive and here sharing my story. We cherish every moment that we get, that we're gifted thanks to emerging treatments. Because when I was diagnosed, I had over 50 seedings of tumours that were left in my small bowel. I was sent home from hospital with no treatment, no cure, and a prognosis of about 12 months to live. I've been very fortunate that newer treatments have emerged just in time to control my disease. Of the 26 years, I've only been eligible for PBS-funded treatments for 6 of those years. So when my disease progresses, it's very stressful trying to work out what treatments are available and how much they will cost. My current treatment has controlled my multiple liver lesions for the past 7 years. It's not funded by the PBS, but has kept me alive since 2015. I'm very fortunate that it's working and dearly hope that continues. My value to George is infinite, which is the case for every mum and their child. In the first instance, it involves getting George to rugby and basketball on time and making sure the pantry is stocked with food. But of course, my value and our value as parents runs so much deeper. We've been gifted the opportunity to bring up a boy who'll be part of the next generation of citizens. And of course, without my treatment, he would never have existed. He has value and will contribute to the next generation, as does every child who is born to a parent with a rare cancer, or would have been born if they had the opportunity to receive treatment. When George was in 3rd grade 7 years ago, Tom and I had one of those tough appointments with my oncologist. My scan showed my disease had progressed. It was apparent that I was at the end of the line of my funded treatments. This was the moment I realised the difference between being at the end of the line of treatments versus being at the end of the line of funded treatments. Tom and I had been following the latest research and I'd been participating in clinical trials, so I knew there were more treatment options, but none were funded, nor was I eligible for any clinical trials. We had an 8-year-old at home and I wasn't going to stop fighting knowing that there were treatments out there still available. We took the very challenging decision to run a fundraising campaign to fund my future treatments. This was not a decision we wanted to make. It was deeply embarrassing to ask our family and friends and strangers for money. It was also very hard to share my biggest fears and anxieties about my disease with the broader community, especially with a young son at home. We had tremendous support from our family and the community. Although I had a lot of people asking me, are you sure you can't get treatment? My mum or my sister, my brother, they went to the hospital with bowel cancer and they just got treatment. It doesn't make sense. It doesn't seem right. They were right. It doesn't make sense. It doesn't seem right. But it was my reality, and it's the reality of thousands of Australians. The fundraising went well, but it was really hard. Midway through our 3-month campaign, I stopped doing school pickup because I couldn't handle being confronted with questions about my health and prognosis on a daily basis. Although these wonderful people had just given us money, they were just being kind, and I felt obligated to answer their questions, but we'd completely lost our privacy. Some of the comments were hard, and some were from the 7-year-olds were hilarious, but also jarring. Comments like, how are the tumours going? Or have you raised enough money to stop the tumours growing? The school had raised thousands of dollars from selling hundreds and hundreds of cupcakes. It's really hard to raise that amount of money in a school. And despite raising thousands of dollars, depressingly, it only covered a few weeks' worth of treatment. Having a rare cancer is expensive. There have been many moments since I've been diagnosed that I have felt like I've had less value because my cancer isn't common. When I get an MRI every 12 weeks, it costs me $800 out of pocket, but the exact same scan for someone with liver damage from excess alcohol, it costs $0. When a patient with a more common cancer gets his treatment for $50 a month, and the same medicine costs a GIST patient $12,000, that feels very unfair. My value to the community is measurable in a few ways. As a mum, as a wife, a carer to my husband, a teacher. I was in my first year of uni when I was diagnosed with GIST. Since then, I've had a very fulfilling 15-year primary teaching career. I've also had moments of being the main carer at home, especially when my husband's unwell. He was diagnosed with a rare disease in 2011, Fabry disease. We were both dealt the unlucky rare disease card, and we soon realised that the rare part is a hindrance, not a help. Everything is harder with a rare disease. By 2011, we were in our 30s, and society had invested over 40 years of education in both of us. I had a teaching degree and Tom went through to get his PhD. We were ready to give back to our community, a return on their investment, and dive into our careers. But in order for that to happen, we needed an investment of healthcare in the form of funded treatment for our disease. My value goes beyond family and friends. I have value to medical research. Everyone with a rare cancer does. Everyone with GIST does. We all have value to medical research. We're all on treatment. Our disease does not have a cure. But there are a range of treatments that improve our quality of life and extends our lives. We're all alive thanks to treatments that have emerged over the last 10 to 20 years. GIST is a disease that responds to targeted therapies. Our treatments stop the progression of the disease, but over time, our body can be clever enough to work around the treatments. And we need to, when a disease progresses, we need to start that next treatment. Right now, there are 7 funded treatments available in America for GIST. In Australia, we have 3. Every treatment extends our life and buys us time. When my disease progresses, I need treatment immediately or it's too late. I don't have time to wait for funding or a lengthy process. Time is everything. Over the past 5 years, I've met with a number of members of Parliament and decision makers in an effort to get more treatments funded for GIST and listed on the PBS. I vividly remember Tom and I casually chatting to a few senior decision makers after I gave a speech. One of them asked me what treatment I was on, and I explained the name and the type of treatment and mentioned that it's not on the PBS, but we were hopeful it might be one day. It was keeping me alive and would be beneficial to so many GIST patients in Australia. Even though it wasn't a cure, it was allowing me to live longer, which was especially important with a young son at home. His response was, well, it's really hard with the rare cancer medicines. They actually don't affect that many people. And if they aren't a cure, it's hard to justify. The thing is, we just can't approve them all. In that moment, I wanted the ground to swallow me up. I'd had all of my hopes dashed in that one moment. Fortunately, Tom was there and could see how much that comment had hurt, and he helped me exit gracefully before I burst into tears. I felt it was a blind acceptance that this is just the way our system is. In that moment, I felt I had zero value. And the policy to fund treatments for rare cancers had both a lack of empathy and imagination. Sadly, I've heard similar comments by 3 people since that day. By not investing in rare cancer patients with access to affordable treatments, as a society, we're forming the judgment that our lives are less valuable and therefore have less impact on the community. As a society, we can't celebrate diversity in all its forms and then select out when we decide it costs too much. When we lose people with a rare cancer, we lose their genetic story. As patients, we want to find a cure, improve our quality of lives, participate in research and trials, find a cure for the next generation. We need to be alive to do that. Why can't we strive for equity? Putting us in the too hard basket won't make the problem disappear. I didn't choose to have a rare cancer. None of us did. We have value to our families and our community, yet we are not valued as equal when it comes to access to treatment. This is not a new story for patients with GIST or with rare cancers. Over the past few years, I've had a number of patients reach out to me who are in a similar situation. We chat about access to treatments, which chemist to buy the non-PBS funded treatments from, pros and cons of running a crowdfunding campaign, and sharing our story to the media. Then there's some really uncomfortable conversations. A patient reached out to me to talk about my current treatment. He'd been quoted $12,000 a month for the same treatment. His disease had progressed and all future treatments were to be funded by him and his family. If he maxed out his mortgage, he could still only afford 6 months' worth of treatment. We chatted about our value to our families. He then said to me, I just have to work out if an extra 6 months of life with my family is worth $75,000 on my mortgage. My wife says yes, but I can't bear the idea of dying and leaving her with a maxed out mortgage. He decided against the treatment. How do we measure value? I've heard many people say that it's hard to measure or too hard to measure. But as a society, we face hard problems all the time. Hard problems deserve creative solutions. We deserve a solution. We deserve treatments that won't bankrupt our families. We all have value to our community. I've heard so many times that our approval system is an international gold star standard. But it can't be gold standard if it's excluding so many patients from access to treatment. We need equal access to treatment. Without equal access to affordable treatments, we won't live longer. We won't be here for our families. We won't survive. I dearly hope that there is change soon. That change would give me hope that I will be able to see my son grow up and give all rare cancer patients hope with equal access to treatment. Thank you.